Here is something I have seen happen too many times in my career. A patient walks into my office, blood pressure still elevated, and they hand me a list of everything they have changed over the past 6 months. Less red meat, more walking, cut out coffee, sleeping better, reduced stress as much as they can, and they look at me and they say, "Doctor, what else am I supposed to do?" And the honest answer, the one that changes everything, is not another thing to cut out. It is understanding what your body is actually responding to. Because what most people are never told is that after 60, your blood pressure is often not driven by your habits alone. It is driven by something happening at the cellular level, something completely invisible that no lifestyle checklist ever addresses. And if you do not know what that is, you can do everything right and still watch those numbers stay stubbornly high. Stay with me, because what I am about to share is the piece most people spend years searching for. I'm Dr. Thomas Reeves, a cardiologist with over 10 years of experience helping patients like you take control of their blood pressure, protect their heart, and improve their overall health. If you're new here, welcome to the channel. Before we go any further, if you're serious about maintaining healthy blood pressure, strengthening your heart, and living with confidence, hit that subscribe button and turn on notifications. I share real information backed by real science for people just like you. And if this topic matters to you, type 1 in the comments and tell me where in the world you're watching from. If not, type 0 so I know how to help you better next time. Now, let's get into it. Let me start with what I hear most often from patients over 60. They say their doctor told them to watch their salt, take their medication if prescribed, and exercise more, and so they do exactly that. They swap table salt for herbs, they read nutrition labels, they walk every morning, they do the work. And for some people, yes, those changes help. But for a very significant portion of adults over 60, blood pressure stays elevated anyway. Not dramatically, not dangerously in every moment, but consistently above where it should be. Enough to keep their doctor concerned, enough to keep them on medication, enough to make them feel like their body has simply stopped cooperating. Here is what I want you to understand before we go any further. Their bodies have not stopped cooperating. Their bodies are cooperating perfectly with a signal that most people do not even know exists. And that signal is the reason everything else feels like it is not working. Keep that in mind as we go through this together. Now, most conversations about blood pressure start and end with sodium. And sodium absolutely matters. I am not here to dismiss that. But here is what the sodium conversation misses entirely, especially for older adults. Your kidneys do not respond to sodium by itself. They respond to hormonal instructions. And the most powerful hormonal instruction your kidneys receive comes from a hormone called aldosterone. Aldosterone tells your kidneys to hold on to sodium and water, and when it stays elevated for too long, blood volume expands, pressure builds, and no amount of salt restriction fully compensates. So the real question is not just how much sodium you are eating. The real question is, what is keeping aldosterone elevated in the first place? And the answer to that question leads us somewhere most people are not expecting. Before we get there, let me just recap quickly. Salt restriction helps, but it addresses the input, not the signal. And for many people over 60, the signal is the problem. That is what we are going after today. The answer traces back to a system in your body called the renin-angiotensin-aldosterone system, which I will simply call the RAAS. Most people have never heard of it, but inside your body right now, this system is either quietly protecting your blood pressure or quietly elevating it. And after 60, it becomes far more sensitive. Here is how it works in plain terms. When your kidneys detect low blood flow or low sodium, they release a signal called renin. Renin triggers a chain reaction that ends with aldosterone being released. Aldosterone tells the kidneys to hold on to sodium and water. More water retained means more blood volume. More blood volume means higher pressure. This is a survival system. It evolved to protect you during dehydration or blood loss. The problem is that in modern life, especially after 60, this system gets activated not by real danger, but by chronic low-grade stressors that never fully turn off. Things like disrupted sleep, chronic low-grade inflammation, prolonged emotional stress, poor circulation in the kidneys themselves. When any of these stressors persist, the RAAS stays partially switched on, not dramatically, not in a way that shows up on a basic lab panel, just enough to keep aldosterone slightly elevated, keep sodium retention slightly elevated, and keep blood pressure slightly but consistently above where it should be. And here's the part that makes this so frustrating for patients. None of those stressors feel like a medical emergency. Slightly poor sleep does not feel catastrophic. Low-grade inflammation has no obvious symptoms. Reduced kidney circulation often produces no pain at all. So people go through their days feeling reasonably okay, doing all the right things, and never realizing that this silent system is quietly working against them. Let me pause right there and bring this back to something real. Think about the last time your blood pressure was checked and the number surprised you. Maybe you had slept fine. Maybe you had eaten well that day. Maybe you had even gone for a walk that morning and the number was still high. That was not random. That was your RAAS doing exactly what chronic low-grade activation does, keeping the baseline higher than your habits deserve. And once you understand that, you stop blaming yourself and start looking in the right direction. So what activates the RAAS chronically in adults over 60? There are three primary drivers that I see again and again in my practice, and they are almost never discussed in the standard blood pressure conversation. The first driver is reduced kidney perfusion. As we age, blood flow to the kidneys naturally decreases. The kidneys interpret this reduction as a sign that pressure is too low and that the body needs to retain more fluid. Even if your actual blood pressure is high, the kidneys may be receiving less flow than they need due to arterial stiffening, which is completely common after 60. They respond by activating the RAAS. So your kidneys are essentially trying to solve a circulation problem by raising pressure even further, which creates a cycle that is very difficult to break with lifestyle changes alone. The second driver is sleep fragmentation, not total sleep deprivation, just broken sleep. Waking up once or twice a night, sleeping lightly, not reaching deep restorative sleep. Research is very clear on this. Fragmented sleep keeps cortisol slightly elevated. Cortisol activates the RAAS. This is one of the most underappreciated reasons why blood pressure readings are consistently highest in the morning. It is not stress from the day ahead. It is the hormonal residue of a night where the nervous system never fully rested. Now, before I continue, if you are finding this valuable, please take a moment right now and subscribe to this channel. I publish this kind of in-depth cardiovascular information specifically for adults who want real answers, not generic advice. Hit subscribe and stay with me, because what comes next is where the real practical solution lives. The third driver is chronic low-grade inflammation. This one surprises people because inflammation sounds like something you would feel. A hot joint, a swollen area, obvious pain. But vascular inflammation, the kind that affects blood pressure, is largely silent. It is driven by disrupted gut health, poor sleep, processed food intake, physical inactivity, and years of accumulated oxidative stress. In the blood vessels themselves, chronic inflammation reduces the production of nitric oxide, which is the compound your vessel walls use to relax and widen. Less nitric oxide means vessels that stay slightly contracted. Slightly contracted vessels mean higher resistance. Higher resistance means higher pressure. At the same time, this inflammation signals the RAAS to stay active, so you get a two-front problem: vessels that cannot relax fully and kidneys that are retaining too much fluid. That combination is extremely common in adults over 60, and it is exactly why blood pressure can stay elevated even in people who appear healthy from the outside. Let me bring all three of those together for a moment so this is clear. Reduced kidney perfusion keeps the RAAS activated. Fragmented sleep keeps cortisol elevated and the RAAS running. Chronic inflammation prevents vessels from relaxing and reinforces fluid retention. None of these three things are caused by eating too much salt, none of them are fixed by eating less salt, and none of them announce themselves with obvious symptoms. That is why so many people over 60 feel genuinely confused about why their blood pressure is still elevated. They are managing the inputs without addressing the signals. Now here's where this becomes genuinely hopeful, because all three of these drivers respond to specific, targeted interventions. And they are not extreme. They are not complicated. They are accessible to almost anyone over 60, regardless of fitness level or existing health conditions. For kidney perfusion, the most effective intervention is consistent, gentle aerobic movement. Not intense exercise, not anything that strains the joints. Walking, cycling on a stationary bike, swimming, even gentle water aerobics. What this type of movement does is improve renal blood flow directly. When the kidneys receive better perfusion, they have less reason to activate the RAAS. The signal quiets, sodium retention decreases, blood pressure follows. The key word here is consistency. A 30-minute walk 5 days a week does more for kidney perfusion than an intense session twice a week. Steady, regular movement is the goal. For sleep fragmentation, the intervention is nervous system regulation before bed, not sleep medication and not necessarily sleep restriction therapy. Simple, evidence-supported practices that signal to the nervous system that the threat response can stand down. Slow breathing before bed, reducing light exposure in the hour before sleep, keeping the bedroom cool, avoiding food or stimulating conversation close to bedtime. These are not tips from a wellness magazine. They are physiological inputs that reduce nighttime cortisol, allow deeper sleep stages to occur, and give the RAAS a genuine overnight window to downregulate. Patients who improve their sleep quality often see blood pressure changes within 2 to 3 weeks, sometimes faster. For chronic vascular inflammation, the two most powerful interventions are dietary polyphenols and omega-3 fatty acids. Polyphenols are found in deeply colored plant foods. Berries, beets, dark leafy greens, pomegranate, and green tea are among the strongest sources. These compounds directly stimulate nitric oxide production in vessel walls. More nitric oxide means vessels that can relax more fully, which reduces vascular resistance and lowers pressure. Omega-3 fatty acids found in fatty fish like salmon and mackerel, as well as in quality fish oil supplements, reduce the inflammatory signaling that keeps vessels contracted and the RAAS elevated. When you combine these two together with consistent movement and improved sleep, you are addressing all three primary RAAS drivers simultaneously. That is when people start to see meaningful, lasting changes in their blood pressure. Let me bring this all together clearly. If your blood pressure is staying elevated despite doing the right things, the most likely explanation is that your RAAS is chronically activated due to reduced kidney perfusion, fragmented sleep, or low-grade vascular inflammation. Salt restriction alone cannot fix this because it does not address the signals. The solution is improving kidney blood flow through consistent, gentle movement, calming the nervous system before sleep to reduce overnight cortisol, and reducing vascular inflammation through polyphenol-rich foods and omega-3 fats. These three interventions work on the root system, not just the surface numbers. Now there is one more piece I want to add before we close, and it may be the most important thing I say in this entire video. Blood pressure is not just a number to manage. It is your body's way of telling you how well your cardiovascular system is functioning. When the RAAS stays chronically activated, it does not just raise blood pressure. Over years, it contributes to arterial stiffening, left ventricular strain, and reduced kidney function. Managing blood pressure is not cosmetic. It is foundational to how well you feel at 65, at 70, at 75, and beyond. Every intervention I described today does double and triple duty. Movement protects the heart and the kidneys. Better sleep protects the brain and regulates hormones across the board. Reducing inflammation protects the vessel walls, the joints, and the immune system. When you address your blood pressure through these channels, you are not just bringing a number down. You are actively investing in the quality of your years ahead. And for anyone watching today who has felt frustrated, confused, or discouraged because they have been doing everything right and still seeing those stubborn numbers, I want you to know clearly, you were not failing. You were solving the wrong problem with the right effort. Now you know where to direct that effort, and that changes everything. If this video gave you something new to think about, share it with someone who is also navigating blood pressure challenges. Leave a comment below and let me know which of the 3 drivers resonates most with your experience. Is it sleep, circulation, or inflammation? I read those comments and your answers genuinely help me understand what to cover next. I will see you in the next video.